Hi, it's the Nursing Professor back again to help with your road to the final. So today we're going to actually talk about health assessment. This video is going to be good for anybody in any particular nursing course that they have going on, because in every nursing course, be it maternity, mental health, peds, we have to know how to do an assessment. So primarily this is for adult health assessment, but these same concepts can be used with any of the specialties. So there are going to be 7 concepts that we're going to discuss. So let's jump right in. So number 1 is we need to know types of assessment. So what that means is a comprehensive assessment would be your general survey, your head to toe assessment, where you're getting information from your patient. You're asking them all about their health history, their family history, what brought them in today, as well as you actually observing them in order to gather some data as well. So you're looking at their appearance, if they have missing teeth, all those types of things like that. All right. So with your comprehensive assessment, you're going to have 2 types of data that you're going to get. Objective, meaning that is information that you're going to obtain by what you see, any type of test that you do, like vital signs, palpating your patient, any of those things. Subjective is going to come directly from your patient. And so you're going to listen and make sure that you hear their story. When you are doing a comprehensive assessment, you want to make sure that you are having somewhat of a conversation so that person can tell their story. Because if you have a checklist, you're not going to get much data there. So do not ask a person, what's your date of birth? When the last time you saw a doctor? And never ask them the question why. Okay? Because if you ask a question why, it puts a person on guard. Like, what do you mean? Why? Why I haven't been to a doctor in 10 years? Because I haven't. Okay? So you want to be careful of things like that can be quite intimidating to your patient. All right. You want family history, their previous medical history, any surgeries or anything like that they've had. Now, along with this comprehensive assessment, you can also pull out your other tools of appropriate assessments. For example, if this person has a neuro problem, you're going to pull out the Glasgow Coma Scale to do an assessment there. If this person appears to be at risk for falls, then you pull out the Morse Fall Scales. If this person has an open area, you pull out the Braden scale. You see where I'm going? All right. And the last one that we don't use so often, but we probably should, is CIWA, C-I-W-A. That is an assessment tool to determine if this person is at a great risk for alcohol withdrawal. So if you're having a conversation with your person doing a comprehensive assessment, they tell you they drink 5 drinks every day, you should definitely do a CIWA scale to determine that, because the last thing we would want is this person to have withdrawals and there's no documentation that this person has an alcohol problem. All right. Okay, so the next type of assessment is a focus specific assessment. That is when you look at one area of the body, person's chief complaint. If they say the stomach hurt, then you're going to look at the stomach, you're going to listen for bowel sounds, and then you're going to palpate. So remember, that would be an example of a focus system assessment. Follow-up would be that you're following up on any existing problem. So you're doing an assessment based on that. And emergency assessments do exist as well. Those rapid responses, those persons that are coming into the emergency room. And that's when you're going to pull out your ABCs. If it's airway, you got to be able to address that airway situation right away, breathing, and circulation, of course. So these are the people that might be having a heart attack or coming in with some sort of trauma that need to be addressed right away. All right, if the person can't give you information, then you can certainly get it from their family members, but you really do want to have that one-on-one conversation with the person if they are alert and oriented. So number 2 concept we want to be aware of is vital signs. So with vital signs, we need to know our norms. So normally temperature for an adult is anywhere from 36.5 to 37.5. Heart rates are between 60 and 100. Respirations are between 12 and 20. And our blood pressures are 120 over 80 or less. So any alteration in of that should be addressed and should be documented. The most accurate way of taking a temperature, you should know that. Rectal is the most accurate way because it assesses core body temperature. You should know how far that thermometer should go in. You should make sure that you know to put lubricant on that thermometer. Swan-Ganz catheters can also be used as an internal source of being an accurate way of measuring body temperature, but usually those questions don't come unless you're taking a critical care course. All right, know how to find the apex of the heart, because that is the best place to listen for an apical pulse. On a woman, you typically want to do the mid-clavicular line, come on down the nipple, lift up the breast, put the diaphragm between the fourth and fifth intercostal space. Radial pulse is usually on the thumb side, or always on the thumb side, I should say. And so you should know those places, because sometimes questions will ask you that. Number 3 is a pain assessment. This is where you can use Wong-Baker, where you use those little smiley faces if a person's unable to give you between 0 and 10, 10 being the worst pain that they have had. You can also use the PQRST or some variation of that. If you use PQRST, P stands for provocation. So, what makes this worse? Q stands for quality. Is it stabbing? Is it sharp? A person should be able to describe that to you. R stands for region. They should be able to explain your location. S stands for severity. That's where the 0 to 10 can come into play, and they can describe that a little bit more. And then T stands for timing. So when does this happen? First thing in the morning? Is it after you eat? Things like that. You should know the difference between acute and chronic. Acute is sudden and severe. Chronic is a person's had it for a while. You should know the difference between somatic and visceral. Somatic pain is typically skin, muscle, and bones. You usually can describe that pain, and usually a sharp pain. Whereas some visceral is usually internal, and a person will have a harder time describing that pain. But sometimes they'll say it's dull, it's vague, it's always there, so it's a little more difficult. Number 4 is integumentary. Skin is the largest organ of the body, and so you're going to go back to that Braden scale that we talked about. If a person has an open area, then you want to use a Braden scale. If all of the skin is closed, then you want to use the ABCDE assessment tool, where you're assessing for asymmetry. Does it look similar side to side? Border, are there any raised areas there? Color, what color is it? Diameter, know that when you're measuring a wound on the skin, it's up and down and then side to side to get your measurement. And then evolving, is this getting bigger? So the person can tell you those types of things. Number 5 on the list are system-specific assessments. That's when you're looking at head and neck. You're assessing cranial nerves. You're assessing Snellen chart, what their vision is like. And if you're using the otoscope, you should know that pulling the pinna up and back for an adult is what you should do, whereas a child should be down and back in order to be able to look in the ear canal. Respiratory, of course, is listening to the lungs, being able to identify abnormal breath sounds like crackles, rhonchi, wheezing. Those would be examples. Cardiovascular, very similar to respiratory. You pull out that stethoscope and you listen to the heart, be able to identify abnormal heart sounds. You can also test capillary refill by holding the nail bed, and it should respond within 2 seconds or less. If not, it could be a sign of dehydration or impaired circulation. You want to assess for edema, and that is swelling. You want to be able to determine if it's pitting or not, and be able to document that. Number 6 is cultural competence, where you're always going to consider someone's background, their religious beliefs, things like that. Give your person space and freedom to discuss anything that is culturally sensitive to them or something they want you to be aware of. Number 7, last but not least, if it's not documented, it's not done. It is so important that we document any of our findings, because we're not at work every day. And so our co-workers, our team members should be able to follow up based on our documentation. The other form of documentation I'll leave you with is SBAR. You should know SBAR and how it actually works. S is situation. You describe the person 64 years old that came in with chest pain. B, give us some background. They had this chest pain for 2 weeks. It's getting worse. Assessment is what you actually hear, what that person is able to tell you. And R is recommendations. Your recommendations are always interventions or actions that that you will take. So I hope that helps. I hope you're successful on your exam. If I forgot anything, please drop it down below. I'll see you next video. Bye for now.